As in other countries, the Catholic Church in Papua New Guinea is very concerned about the prevention of mother-to-child transmission. HIV can be spread from a mother to her unborn child during pregnancy, during delivery, or through breastfeeding. The United Nations aims to eradicate paediatric HIV by 2015. The National Catholic AIDS Office has made a commitment to reduce the number of cases in Papua New Guinea. Programs aimed at the prevention of mother-to-child transmission are in place across the country.
We have a wonderful success story which we had in Mingende in the Chimbu province, done by the Sister Kinga and the nurses, where we had 25 positive mothers going through the program and we had 25 negative babies. So the story of the little hospital in the highlands region of Mingende has reached many countries, and it's a good news story and we should proclaim it. But not only proclaim it, we should learn all from it so that we can duplicate this in many other areas.
In Mingende, as well as the successful program for the prevention of mother-to-child transmission, staff also offer voluntary counselling and testing, as well as antiretroviral treatment for those with HIV. Training was provided to all staff at the commencement of these programs.
My overall responsibility is to oversee all the activities that we run in the hospital, and one of them is taking care of the maternity ward. And maternity ward comprises of antenatal clinic, labor, delivery, postnatal, and also we are taking care of the nursery babies who are born with low birth weight, and some babies with neonatal infection. We do admit them into the nursery and we take care of them. So we have quite a big number of mothers coming, not only from Mingende, but they are also coming from outside of Mingende area. We are seeing mothers coming from Western Highlands, all over Chimbu, and also Eastern Highlands. So the work is quite heavy on the nurses who are currently working under maternity section.
All patients who come to the Mingende clinic are given information about HIV/AIDS. They're asked if they'd like to be tested. If they wish, they're tested for HIV. For those pregnant women who are HIV positive, the Mingende clinic offers services to try to prevent the transmission of HIV to their babies. Fathers are also invited to be involved in this program. The health of both parents is important so they can raise their child.
Mi play Churchill service lo Simbu and mi play partnership one time Caritas Australia. Mi play time lo look long. All arpla STIs or some gonorrhea or syphilis or chlamydia, all these low infections where ista one time all man merit as all plenty time all mag lo sigi no complex kilia. So lo this la program in people time lo look na schooling all man merit by look sawe lo this la sick na and then provide him services along all.
In Papua New Guinea, women are more likely to get tested for HIV than men. The National Catholic AIDS Office noticed more women than men accessing VCT services. Already on offer were clinics for pregnant women and vaccination clinics for babies. Then a men's clinic was opened in Mingende in Chimbu province in 2009.
Men felt all of a sudden that they also counted, and they came in large numbers to attend the clinic.
On men's clinic days, male nurses and male doctors work at the clinic. This makes men feel more comfortable. After being given information about sexual health, men are often willing to be tested for HIV and other sexually transmitted infections. The presence of other sexually transmitted infections, such as syphilis, can increase the risk of a person contracting HIV. In a number of cases, men who tested positive for a sexually transmitted infection later brought their wives along for treatment.
Plenty time all money is feeling symptoms lo kam na story good lo animal problem long all simple problem all is symptoms lo talk out or so me play provide him this la and mo sem all man tas all by look lo one him service all man by sim long and
Training is conducted throughout the country. Training and awareness sessions are available for any group wanting information: youth groups, schools, teachers, women's groups and others. The National Office also conducts training for staff on various topics such as couples counselling and the prevention of mother-to-child transmission. A recent focus of training has been a new testing mechanism which allows for initial screening tests to be conducted within centres, followed up by confirmatory tests also conducted on site. This is a big improvement. Until recently, blood samples were sent away to provincial or regional hospitals. The new mechanism has eliminated long waits. It means that an individual can leave a centre with their HIV status confirmed.
So they've been doing the screening, and now when they go back, they'll start doing the confirmation on site. So the purpose of this training is to really equip our counsellors to do the confirmation, because the turnaround time for the HIV test result was always a challenge.
Well, it is a great thing that we're implementing it now right down to this level to where all the testing sites are, because previously only the confirmation was done at the reference laboratory, which is the Central Public Health Laboratory. But then we saw that results were not going out quickly to the patients. So they were not being referred for care and treatment quickly.
ASHM is the Australasian Society for HIV Medicine. ASHM regularly sends doctors from Australia to mentor and teach health workers in the Church's centres. This has helped the Catholic Church to monitor and improve its services. Dr. Aaron Menau has been visiting and working in Southern Highlands Province. He's been reviewing the use of antiretroviral therapy for people living with HIV.
There are nearly 439 people who are on treatment here in the Southern Highlands in the Catholic Health Services, and there are very few defaulters. There are very few people who miss out on their medications, and there are very few people who don't come back. And I think that's a testament to the quality of the staff to make sure that people come back all the time for their routine care. So I think they're doing a good job here.